Frank, it is so good to see you. We have such an important topic today: 4 ways to address long term care and medical expenses in retirement. According to Fidelity, the average 65-year-old couple will need nearly $315,000 for healthcare in retirement. That's not even including long term care, which, as you know, 7 out of 10 people will need at some point, and that's not covered by Medicare. So let's talk through our options. The first is traditional long term care insurance. What are the pros and cons?
I think the biggest benefit of traditional long-term care is the peace of mind, knowing
Yeah.
that you have the money to pay for the needs that you needed as you age, such as making sure that you have enough money for in-home health care, if you have enough
Mhm.
money for assisted living, if you have enough money for nursing home. That is really a key component of knowing that, by the way, you don't have to use your own money. You've got insurance money to
Yeah.
really share the risk and pay for it.
Mhm. Absolutely. It's robust coverage. But what are the cons?
Well, there's a lot of challenges in the traditional long-term
Yeah.
care. It's either you use it or lose it. People have been paying a lot of money in, and if they don't use long-term care, they lose it. It's like car insurance. And then the second thing that they look at, is the biggest challenge lately, is the increasing of the premiums, and
Yeah.
that is really, there's some cases it's 270%, and it's really scaring a lot of people, and it
Mhm.
also reduces the benefits. And the third thing, you got to qualify
Yeah.
for the insurance.
Yeah. Really good point. All right. Our next option is called asset care. How does this work?
When I talked about use it or lose it, in this particular instance, the great thing about the asset care is predictability. That
Okay.
if you don't use it, there is a death benefit complied. So the beneficiary gets the complete money. So it's almost like return of
Mm.
premium if they don't use it.
Mhm.
So that's really a key factor. The other predictability is the fact that the premiums never increase, nor do the benefits ever decrease. So people
Interesting.
want a sure thing. They're tired of being Buffalo to say, oh boy, this is going to happen, and then they get a curveball happen. So in this particular instance, they get a very sound. What we do at Riley Higgins, make sure that there's predictability. You know what's going to happen, so it really fits in your comprehensive financial plan.
Absolutely. Like you were just saying, comes back to peace of mind. All right, let's talk through option number 3 here, which would be to self-insure. But this is difficult, of course, and risky. And just to point out, again, I know you live in this world, Frank, you're well familiar with it, but it's also very expensive. The cost of long-term care projected out here 20 years from now in 2043, if you look at that right-hand column, going to cost anywhere from $124,000 a year to
Wow.
$211,000. That's incredible.
Yeah, you have a catastrophic long-term care event, it impacts the family.
Right.
And if you've ever experienced watching someone age or go through that process, you know that it is horrific. And
Yeah.
whether you self-insure or not, it's what, how does the family take that? How are you going to handle that? Because it's quite complex. You got to look for all the different providers, who's going to help with that. And so there's a lot of stress, even if you have enough money financially, but it's also stress emotionally. And that is one of the biggest drawbacks of insuring yourself. Are you sure you're ready to handle the long term care event? Because it could derail you very quickly.
Right. And then the last option would mean becoming a dependent, which is also the reality of what happens if you don't have a plan.
If you don't have a plan, there's four things that Riley Higgins that we do, and it's making sure, where do you want the care? Do you want it at home? Do you want it at assisted living? Do you want it in a nursing home? And you look at who's going to provide that care. Is your
Yeah.
family going to participate? Are they close? Do they have the resources? Third thing you look at is, what does it cost? And then
Yeah.
the last thing is, who's going to pay for that? And that's
Right.
really a key. And in most cases, if you don't have the money and you haven't been prepared, then the state takes care of it, and then you lose all control. And that's the last thing you want to do, and
Absolutely.
be a burden to your family.
Right.
Yeah.
Absolutely. Well, Frank, it's so helpful to talk this through. Clearly, some options are better than others, but the point is to have this conversation now, sooner rather than later. So if somebody would like to sit down with you and consider these options and figure out what's best for them and their family, what's the best way to reach you?
You can reach us at 480-581-8545.
All right. Frank, thank you so much for your time
Thank
today.
you
I
so
really
much for your
appreciate it.
time. Thank you.